Hey everyone, Luke Gordon here, and today's topic is all about pain and how pain negatively affects balance. In my opinion, this is one of those videos, one of those topics that is really underappreciated, but if you're struggling with your balance, feeling unsteady, feeling wobbly, afraid of falling, this could be one of the biggest things that your medical team is currently missing. Even if you're seeing what you would consider to be a good PT or you've got good doctors on your staff, this is one that I think is really overlooked a lot and can have a really positive impact on your balance, your mobility, your overall risk of falling. So that's what we're going to talk about today, how having pain in different parts of your body, whether it's a hip or a knee or your low back, sciatica, how it's going to negatively affect your balance and what you can do about it in addition to all the other things you're doing for your balance. So just as a little bit of background, if you've watched any of my videos on balance and fall prevention, there's a lot of information that I've shared already in terms of what goes into maintaining balance, in terms of how you sense your balance, how your body responds, how strength impacts your balance, how your inner ear and vertigo impacts your balance, some of those types of things. So keep all those in mind. This is just going to supplement those ideas and those videos as one more thing that you can use in your toolbox to improve your balance and again improve your confidence and reduce the likelihood of having another fall. So let's dive right into it. And one of the most common things that I see working with older clients is you'll have a client who's coming to PT for their balance, and we're working on strengthening certain parts of their body. We've uncovered that their inner ear is weak, so we're doing specific balance exercises, things with head turns, things on a squishy surface, things with their eyes closed, all these ways we can challenge their balance. But let's say this person also has like a hip pain, which the most common one you'll see, especially in older adults, is a hip bursitis, where if you push along the outside bone along your hip, it's going to hurt. You're going to find a tender spot there. Super common, but also super treatable. So let's just say this client comes in to work with one of my PTs here at the clinic for PT. The referral says, do strength, do balance, do mobility. That's all great. So the PT just dives right in and does all that stuff. Never really pays attention to that hip pain. So how is that hip pain negatively affecting the client? Well, if you can imagine, if you have pain in your right hip, what do you think you're going to do? What I see people doing is you're going to shift away from that right hip. You're going to shift over to your left because the right hip hurts. It hurts when you put weight through it, so you're shifting your balance over to the left. So by default, your balance is now already away from your midline, which is where you want it. So you want to maintain your balance and avoid a fall. Essentially, all you have to do is keep your center of gravity, your weight, between your feet. So with the right hip pain, you're now shifting to the left. You're that much closer to the edge of your balance on your left side. So that's the first thing. But also, what happens to your right leg when you stop bearing weight through it so much? Let's say you shifted 30% of your weight from the right to the left. What do you think happens to that right leg? As you can imagine, not only is the hip getting weak now, the entire leg is getting weak. From your ankle muscles to your knee muscles, to all those hip muscles, to all your core muscles. So now, if you have an issue with your balance and you need those muscles to kick in and correct, especially those ankle and hip muscles to correct your balance, now they're not strong. The chances of you falling have just gone up. So hopefully that kind of helps you understand that this pain has a really direct impact on your balance. Even if you're going in for PT and part of your program is that they're strengthening, your hip and your ankle muscles on the right leg, will it be successful? And I would argue that no, it's not. It's really difficult to strengthen sore muscles. So again, with that hip bursitis, it's more of a tendonitis in my opinion, or a tendinosis, but either way, it's a sore hip, it's painful, the muscles are painful, they hurt. Again, if you push along them, you should be able to come off the bone a little bit on the outside of the hip and you'll feel some tender points there. Do you think that you can just strengthen a sore muscle with things like side leg raises and clamshells and squats and all those good exercises? Again, I don't think so. So what the average PT is going to miss then, in my opinion, and from what I've seen from experience, is they're going to miss the fact that they have to help you with pain relief. They have to help you with pain relief. If they don't, they kind of go the lazy route or the underachieving route and say, well, I'm going to help you with your balance. I'm going to help you strengthen those muscles and we're going to work on the balance. And, you weren't referred for a sore hip and I really don't feel like doing the hard work of getting in there and massaging your hip and breaking down scar tissue and improving blood supply. So I'm just going to do my best with exercise-based stuff. They're missing a huge point. And if you haven't keyed into that, which you wouldn't because you're not a therapist and you haven't seen it the way I have, you're going to go home thinking, well, we made some improvements with balance and strength, but this hip is still killing me. So what do I have to do? You know, is it surgery? Is it an injection? Hopefully not. So that's what I would say, especially with the hip pain example. It's very treatable. You need your therapist, though, to do some pain relieving techniques, which in my mind, in my world, are hands-on or manual therapy based techniques. Even something as simple as going in and doing a massage, you know, a deep tissue massage, things like that. That's really going to help. So again, that's how pain is going to directly impact your balance. One more example I want to give since we're on the topic. It's a really common one. And actually, sorry, go back to the one we're talking about. Your right hip causing you to shift your weight to the left. How many of these folks do you think end up with a sore left knee? You took the weight off the right, you're 70 years old, 75, 80, whatever, 65, you're a little younger. You shifted the weight away from the right leg to the left leg. How long before the left knee starts griping at you? It's kind of fun to do this in front of a live audience because I can basically fortune tell. I'll ask someone who's got hip pain, how's your hip? Oh, it's really sore. Okay, great. My guess is that you shift your weight away from it. Is that true? Oh yeah, that's true. My guess is also that that knee is sore now too, the opposite knee. Oh yeah, it is sore. Okay, so these things have a dramatic impact on more than just one thing. So you can see how something as simple as right hip pain, which could completely be overlooked, is not only throwing off your balance, limiting your ability to strengthen, but it's also making your left leg sore. The other thing that we haven't talked about is when you shift your weight to one leg versus the other, now your back probably hurts too. You got lower back pain? Most folks do when they're 60, 70, 80 to some level. You got sciatic pain? Yeah, a lot of folks do. Okay, so it's hurting more now. So anyhow, look at how that kind of domino affects a lot of other things. The other one that I just mentioned was lower back pain and sciatica. Now if I'm working with a client and they've got really chronic, moderate to severe low back pain with or without sciatica, which is that pain string down the leg, and they say, well, one of my biggest limitations, Luke, is that I can only be on my feet for 10 minutes at a time, because then, you know, gravity starts to compress my back. I get that real strong pain, that kind of that pushing pain in the middle of my spine, and I got to sit and I got to rest. Okay, that makes a lot of sense. If I'm trying to help you with your balance, your mobility, your independence, because you want to live at home instead of being, shipped off to a nursing home, does it make sense that if I can improve your back pain, that your balance will improve as well? I think it does. Because if I can improve your back pain to the point that you can stand for 15 minutes instead of 10, or 20 minutes instead of 10, how much more active can you be? Now you can strengthen the muscles just by general activity. Now you can actually be on your feet and doing more activity that's going to strengthen your balance and challenge your balance. So again, it's real easy for me to take the, the easy route as a therapist and say, well, you're just here, Mr. Smith, to work on your balance and mobility, and we're going to strengthen, and we're going to do balance exercises and all these things, which are really good. But we did a detailed history on you, and you've got a sore hip, and you've got a sore back. If we can take care of those a little bit too, you're going to tolerate your exercises more, you're going to be more active in general, and you'll be much happier in the long run. So I guess the message of the day is, let's raise the bar a little bit. Just because you're going in for balance and fall prevention, you're working with a trained PT who knows all sorts of things about how to strengthen you and do your balance and all these exercises. If you've got pain, speak up. And if you're a PT watching this video, raise your game a little bit. Quite honestly, it's super easy for us PTs to say, well, the doctor didn't refer you for that, so I'm not treating that. It's like, okay, well, up the game. What if it was your grandma or your grandpa or your mom or your dad? Wouldn't you want to go that extra mile? So again, sorry to get going. My favorite soapbox, though, is PTs that don't have any interest in helping you reduce your pain. They just want to strengthen you. Doesn't work. If you're with that kind of a PT, get another opinion. Shoot me a message. I can, if you're watching from somewhere that's not in my local area, which most people are, shoot me a message. I'll help you hook up with somebody else, or just ask good questions when you go to PT. It's a great time of life to be your own advocate when it comes to your health, and ask lots of questions and see what they're willing to do. So anyhow, that is that's my little message today. If you want more exercises for balance, I'll pop something up here. I just figured out how to do this on YouTube. I'll pop something up there for balance exercises or some hip strengthening exercises. I'll pop that right up here. If you like the video, please like it, leave me a comment, subscribe to the channel. I really appreciate that. Thank you for watching. And like I said, any questions, reach out to me at any time. Have a good day.